In my previous video I'm discuss about diabetes, symptoms, and causes. In this video I'm gonna talking about the treatment of diabetes, diet, diagnosis, prevention, diabetes in pregnancy, and diabetes in children. If you want to maintain your health, stay in shape, then keep watching this video till end. If you like this video, give it a big thumbs up and please subscribe to my YouTube channel, keep your notification on. Treatment of diabetes. Doctors treat diabetes with a few different medications. Some of these drugs are taken by mouth, while others are available as injections. Type 1 diabetes. Insulin is the main treatment for type 1 diabetes. It replaces the hormone your body isn't able to produce. There are 4 types of insulin that are most commonly used. They're differentiated by how quickly they start to work, and how long their effects last. One rapid-acting insulin starts to work within 15 minutes and its effects last for 3 to 4 hours. 2 short-acting insulin starts to work within 30 minutes and lasts 6 to 8 hours. 3 intermediate-acting insulin starts to work within 1 to 2 hours and lasts 12 to 18 hours. 4 long-acting insulin starts to work a few hours after injection and lasts 24 hours or longer. Type 2 diabetes. Diet and exercise can help some people manage type 2 diabetes. If lifestyle changes aren't enough to lower your blood sugar, you'll need to take medication. You may need to take more than one of these drugs. Some people with type 2 diabetes also take insulin. Gestational diabetes. You'll need to monitor your blood sugar levels several times a day during pregnancy. If it's high, dietary changes and exercise may or may not be enough to bring it down. According to the Mayo Clinic, about 10 to 20% of women with gestational diabetes will need insulin to lower their blood sugar. Insulin is safe for the growing baby. The bottom line. The drug or combination of drugs that your doctor prescribes will depend on the type of diabetes you have, and its cause. Check out this list of the various medications that are available to treat diabetes. Diabetes and diet. Healthy eating is a central part of managing diabetes. In some cases, changing your diet may be enough to control the disease. Type 1 diabetes. Your blood sugar level rises or falls based on the types of foods you eat. Starchy or sugary foods make blood sugar levels rise rapidly. Protein and fat cause more gradual increases. Your medical team may recommend that you limit the amount of carbohydrates you eat each day. You'll also need to balance your carb intake with your insulin doses. Work with a dietitian who can help you design a diabetes meal plan. Getting the right balance of protein, fat, and carbs can help you control your blood sugar. Check out this guide to starting a type 1 diabetes diet. Type 2 diabetes. Eating the right types of foods can both control your blood sugar and help you lose any excess weight. Carb counting is an important part of eating for type 2 diabetes. A dietitian can help you figure out how many grams of carbohydrates to eat at each meal. In order to keep your blood sugar levels steady, try to eat small meals throughout the day. Emphasize healthy foods such as fruits, vegetables, whole grains, lean protein such as poultry and fish, healthy fats such as olive oil and nuts. Certain other foods can undermine efforts to keep your blood sugar in control. Discover the foods you should avoid if you have diabetes. Gestational diabetes. Eating a well-balanced diet is important for both you and your baby during these 9 months. Making the right food choices can also help you avoid diabetes medications. Watch your portion sizes, and limit sugary or salty foods. Although you need some sugar to feed your growing baby, you should avoid eating too much. Consider making an eating plan with the help of a dietitian or nutritionist. They'll ensure that your diet has the right mix of macronutrients. Go here for other do's and don'ts for healthy eating with gestational diabetes. Diabetes diagnosis. Anyone who has symptoms of diabetes or is at risk for the disease should be tested. Women are routinely tested for gestational diabetes during their 2nd or 3rd trimesters of pregnancy. Doctors use these blood tests to diagnose prediabetes and diabetes. The fasting plasma glucose (FPG) test measures your blood sugar after you've fasted for 8 hours. The A1C test provides a snapshot of your blood sugar levels over the previous 3 months. To diagnose gestational diabetes, your doctor will test your blood sugar levels between the 24th and 28th weeks of your pregnancy. During the glucose challenge test, your blood sugar is checked an hour after you drink a sugary liquid. During the 3-hour glucose tolerance test, your blood sugar is checked after you fast overnight and then drink a sugary liquid. The earlier you get diagnosed with diabetes, the sooner you can start treatment. Find out whether you should get tested, and get more information on tests your doctor might perform. Diabetes prevention. Type 1 diabetes isn't preventable because it's caused by a problem with the immune system. Some causes of type 2 diabetes, such as your genes or age, aren't under your control either. Yet many other diabetes risk factors are controllable. Most diabetes prevention strategies involve making simple adjustments to your diet and fitness routine. If you've been diagnosed with prediabetes, here are a few things you can do to delay or prevent type 2 diabetes. Get at least 150 minutes per week of aerobic exercise, such as walking or cycling. Cut saturated and trans fats, along with refined carbohydrates, out of your diet. Eat more fruits, vegetables, and whole grains. Eat smaller portions. Try to lose 7% trusted source of your body weight if you're overweight or obese. These aren't the only ways to prevent diabetes. Discover more strategies that may help you avoid this chronic disease. Diabetes in pregnancy. Women who've never had diabetes can suddenly develop gestational diabetes in pregnancy. Hormones produced by the placenta can make your body more resistant to the effects of insulin. Some women who had diabetes before they conceived carry it with them into pregnancy. This is called pre-gestational diabetes. Gestational diabetes should go away after you deliver, but it does significantly increase your risk for getting diabetes later. About half of women with gestational diabetes will develop type 2 diabetes within 5 to 10 years of delivery, according to the International Diabetes Federation (IDF). Having diabetes during your pregnancy can also lead to complications for your newborn, such as jaundice or breathing problems. If you're diagnosed with pre-gestational or gestational diabetes, you'll need special monitoring to prevent complications. Find out more about the effect of diabetes on pregnancy. Diabetes in children. Children can get both type 1 and type 2 diabetes. Controlling blood sugar is especially important in young people, because the disease can damage important organs such as the heart and kidneys. Type 1 diabetes. The autoimmune form of diabetes often starts in childhood. One of the main symptoms is increased urination. Kids with type 1 diabetes may start wetting the bed after they've been toilet trained. Extreme thirst, fatigue, and hunger are also signs of the condition. It's important that children with type 1 diabetes get treated right away. The disease can cause high blood sugar and dehydration, which can be medical emergencies. Type 2 diabetes. Type 1 diabetes used to be called juvenile diabetes, because type 2 was so rare in children. Now that more children are overweight or obese, type 2 diabetes is becoming more common in this age group. About 40% of children with type 2 diabetes don't have symptoms, according to the Mayo Clinic. The disease is often diagnosed during a physical exam. Untreated type 2 diabetes can cause lifelong complications, including heart disease, kidney disease, and blindness. Healthy eating and exercise can help your child manage their blood sugar and prevent these problems. Type 2 diabetes is more prevalent than ever in young people. Learn how to spot the signs so you can report them to your child's doctor. Thank you for watching my video.